Now we've got if the speakers could all come back up again, we've got about 15 minutes to answer some questions. And everybody puts their thinking caps on. Got quite a crowd, haven't we? Whoa. Okay. That's all right, there we go. Thank you all. Now I'll open the floor to anybody who's got a question. Yes, right there. Microphones. Here we go.
This was really fascinating.
You're not on yet, not on.
Really fascinating research.
Still not on. Okay, now speak close to it. That's
All right.
it. Go.
Really fascinating insights into all of your research. A question I have in general, though, is to what extent have you been able to apply it? I mean, I thought it was very fascinating to see how we could empower people to live in their homes longer, and I'm interested to see with the other researchers what changes you've been able to see made in the environment as a result of your work.
Okay, who's going to pick that up? Okay, Kate, why don't you?
I'll take it first. So really quite interesting, you know, my research was done on the master's level, and it was done in cooperation with Reata, and they plan on renovating in the next 3 years. And they had a plan, they'd redone their entire care module, and they were just really getting some insights on how they could better deliver patient-centered care. At the very end of my research, I think everybody in management took a time out and really had to think about, okay, what is our care paradigm and what is the experience we want to create? How are we going to compete in the changing Dutch healthcare system? And what they've decided to do is now actually build a program of experience in addition to a program of demands. So they're right now sitting together and doing additional research to capture who and what they want every room, every facility, every space to be like before they even send it to bid. So not only what kind of choices we're going to make within the layout and the spatial demands, but the feeling as well. So you can see there a huge process change in considering then the importance of patient-centeredness and the integration with care delivery.
Okay. HACRIT guys, you guys have got the most active program.
Well, our program was really about implementation on pilot projects. And there was originally 116 pilot projects. One of them didn't go ahead. But each of those pilot projects were dealing with multiple sites and multiple locations. And they really have been good examples for people to follow. And if you take one of them that was on a ward in a hospital on one particular floor, then other wards were wanting to copy that and roll that out. And the ones that were in the care homes with the local authorities, it would probably be one care home within the local authority area that have got that particular program, and then they really used that to roll out on other care homes. People were particularly proud of the projects that they'd actually got. It empowered them in their role as carers, and they were very keen to share that experience with others. So I think the big thing about the pilot programs was it was very much about changing the physical environment, but it also changed the culture and the attitude and staff satisfaction as well. And they were very proud about what they'd done and welcomed opportunities for others to come and share from that process. So it was quite effective from being a pilot project in then rolling it out in a significant way.
I had a question about the interventions, which was the concern. I mean, how did you determine what interventions to make? Was that done on the literature review, etc.? And to what extent did you achieve what you thought you set out to do with those interventions?
This was a program where it was given to the NHS and the local authorities to make submissions, and there were several criteria that they had to meet. A lot of them were related to the core outcomes that were presented, and the key aspect was that they had to be innovative projects and a degree of innovation and novelty about them. So all of that was driven predominantly by the care homes and the providers, and we had a lot of knowledge sharing once we'd selected the pilot projects, but this was actually driven by the care providers in what they wanted to do and putting their cases forward in a competitive basis to see which were the most novel and exciting projects.
Okay. Do we have, yeah, Alan, another microphone down here.
I think this panel and the last panel shows very clearly, actually, we have tremendous opportunity for elderly. It's not only problem, it's not only challenges. We must see the power of innovation. The government should see is a lot of opportunity, innovation, and employment and business opportunity for this industry that they are sitting here. They can develop. We must look like IT innovation when comes and how they change the society. And I think now Almaz shows very clearly this is investment for elderly, and this investment should pay back to the society, and the industry should have tremendous business opportunity. It's not only problem, but more opportunity, I must say.
Do you think then, having looked at the Chinese situation, I mean, we've always talked about the fact that money follows the process, you know, the economics of that. Are we going to be able to get the Chinese government to engage in this thing? I mean, to spend money on their aged care, something?
I think healthcare is something that one should not only assess it from the money's perspective. We know what money does and doesn't behave always in the individual and society's interest. Yeah. What I think is important in case of healthcare is we have to use a multidimensional approach and also an integrated one, that we don't just discuss the designer and healthcare provider, but also be integrative to involve the society, the practitioner, and those who finance should be only one dimension of it. And then society evolves very fast. We have gone within probably 250 years from agri-society to industrial society to service society to information, and also probably biotechnology will be next society. So we have not been able yet to take advantage of all those dimensions. And what is important is, I think, is utilization of resources in most efficient way to be fair and reducing inequality. We have urban, we have rural, we have poor health, we have rich health. And then we have the money, who is the hand of people in financial market, just God knows what is their next move. So that's why I think China, luckily, is large in size, and it has sufficient resources that can take the steps. Still, aging is very low in relative to the rest of the population. So that's why it will be very likely to manage, because the transition is not very fast. Still, we have a lot of people who live in the rural area, who are taken care of by their families, are not putting pressure on the state in terms of finances and manpower. But gradually they have to do, of course, more.
Eventually they'll do something, yeah. Yeah.
I think it's important to realise that some of the interventions can be done at relatively low cost. Avoiding over-shiny floors is one aspect that's associated with dementia. Increasing the lighting levels and using LED lighting not only makes a better lighting environment for elderly people and people with dementia, but it also can save costs. Using high colour contrast in your decoration doesn't really cost that much more. So there's a whole numerous factors that can be implemented that are relatively low cost. We did try to look at the social return on investment in these pilot projects. You had more success than we did, and it's this lack of understanding of techniques like social return on investment within the providers to actually understand, to show what the benefits are and what the return on investment is. And you demonstrated there 3 times return on investment. And therefore, we really need to understand how to demonstrate that social return on investment that's actually taking place.
You've had trouble getting people to take up on your not so much the ones in Hong Kong, to get them to take up this alterations to the houses. Is that right? I mean, you've been going at it, and you've shown the cost benefit, and you've done all these things, but there's still people resisting. I mean,
right,
you've got a long way to go.
The people resist is the elderly because they don't have so much of cash. And also, if they did not have the support from the carers, means that their daughters or sons, they will hesitate to change their environment. And also, they are thinking, oh, I'm dying. No many years to stay in the earth, so why spend so much? But we all, of course, when we try to teach them, and at the elderly, they are the last case, and he was not so so satisfied because he thinks the daughter has spent much money on the renovation. But after we share with him, and they become very happy and know that the preventive, and also the modification will help him to stay independent and more years in their home, and not so no need to go to the care and aged home. In fact, in England, they said the return is much, much better, and they're asking the enterprise to invest more so that to get more outcome and from their investment.
So the 87-year-old wasn't seeing a cost benefit to the family for him to get the alterations made. Is that what it was? He didn't. If he's going to live longer, is that the idea? Yeah, he was going to cost him something to do that. That's unfortunate. Any other questions? Yes. One down there. Go for it.
Paolo, yes. Just following on from the points about social return on investment, and I think one of the other issues is that certainly in the UK, the costs and benefits of investment in this kind of housing improvement fall in different financial silos. So, it might be the housing authority that has to invest in upgrading the homes, but the benefit is actually with the healthcare or social care services financial pockets. So it's actually, unless you have an aligned, integrated model of financing for health and social care and housing investment, it's actually pretty difficult to make these things work, I think.
Does the breaking down of the silos, is that what you're saying, between the various departments?
Too many silos, yeah, and not enough integration.
Yeah, okay. Anyone got any questions back there? Yes, go ahead.
Thank you. I think it was a marvelous presentation by all. The question that I would like to ask, it is very important that we do healthcare at home for the elderly and also design it in such a way that it is more friendly for them to uphold their integrity and respect, because they are us anyhow. But the point is, to some extent, these elderly are still economic unit. Why we cannot utilize their economic ability with the new technology that we are having every day to be utilized in order psychologically satisfying them that they are useful still to the society. Thank you.
This is in the sense that what the individuals feel themselves about themselves. Is that what you're saying?
You know, the issue is they think of themselves and we think for them too, to assist them. They are still X percentage economic unit. We cannot say age 15 up to 60. With the healthcare that we have, definitely we can review our standard. They can be useful, especially in education. Again, going back to the elderly type of culture.
Yeah.
The elders were living with the new generation. And they were the cause of lots of education and passing the culture and the good point of the culture to the new generation. Now imagine they can be the source of education with, you know, electronic type of media that we have got now to educate our children, you know, by sitting at home but still be useful and render their service valuable experience to the new generation, just in line of the education, let alone the others. We can be innovative.
Okay, do you want to take that on, somebody? Our economist.
I think it's a very good idea. Still, we are in a stage of transition that we learn through doing. I think use of information technology is an excellent idea to work at home, but still we need huge investment in order to invest in education to make these elderly who are less skillful in terms of information technology and younger generation to be literacy in terms of information technology. We should also try to be inclusive. Remember, about more than 30% of this world's population, they don't have access to electricity, and they are completely excluded from everything that we discuss about here. Right. So I hope in future, when we discuss, for instance, innovation, so this innovation is such that includes this big share of the population that are very disadvantaged and have not been, have shared any of the development that we talk about. So thank you.
There's also, I'd like to add, I'm not connected with it, that there's really exciting things happening in the Netherlands along these lines, including, you know, answering the housing needs of students with the social needs of elderly. So there's actually up in Groningen, I believe it is, there's an elderly care clinic that actually has free bedrooms, free rent for college-age students. But they're required to spend 30 hours a week socializing with the patients there, or the elderly people. And they've had an enormous amount of benefit in terms of social integration, quality of life for both students and for residents in this nursing home. But additionally, in dementia care in the Netherlands, they're trying to tie young schools with dementia care patients so that there is daily activities that happen between these two communities, because they're almost kind of on the same page in a certain way, and they can do certain activities. For example, like in terms of biophilic design, interacting in a garden and gardening together. That's a task that both can do. They both enormously enjoy, and so this is, you know, working with preschool age to about 10-year-old children. So we need to really start thinking and pioneering and looking outside the box. Why do we think of these very isolated silos of care? Why can't we start integrating different communities in a meaningful way to enrich lives, but also tackle other issues we have, such as, you know, storytelling and lineage and legacy, and as well as, you know, something as simple as student housing crisis. There's opportunities out there in innovation that we need to consider.
Well, thank you very much. I think we've run out of time, so if you want to join me in thanking what's been a fantastic presentation by these speakers. So thank you. Okay.